They have called in the auditors at the Public Health Agency of Canada, and you probably haven't heard anything about it yet because the mainstream media fell for Trudeau's bait and switch national televised address on Wednesday night. You know, I really have to give it to the PMO. They are truly masters of distraction, although it's pretty easy to be masters of distraction when the mainstream media is desperate to be distracted, desperate to change the channel and move on from their paymaster Justin Trudeau's latest unfolding scandal. And no, I'm not talking about the We Charity scandal involving Trudeau's mom, his brother, and members of Trudeau's cabinet. And I'm not talking about that catastrophic Green New Deal speech from the throne we all heard Wednesday afternoon. The latest scandal is just about to unfold, and it's happening at the Public Health Agency of Canada. It was hinted at late last week when we saw a major resignation from that government agency. It wasn't the public face of the Pandemic Preparedness Department who was resigning, though, but it was someone probably equally as important as Dr. Theresa Tam. Just look at this from the CBC. The president of the Public Health Agency of Canada is stepping down only 18 months into the job, leaving the federal agency tasked with coordinating the country's COVID-19 response without a seasoned leader. Tina Namiasnowski said she would be stepping aside immediately to make way for a new president. A spokesperson for Health Minister Patty Hajdu said the government expects to have a replacement for Namiasnowski, quote, in the coming days, end quote. In a letter to staff, Namiasnowski, a long-serving bureaucrat, said she needs to take a break and step aside so someone else can step up to lead the agency as caseloads spike and testing times creep up in some parts of the country. You really need someone who will have the energy and the stamina to take the agency and our response to the next level, she said in internal correspondence announcing her departure, which was later released by the Public Health Agency of Canada. While responding to this crisis, we've done many things since then to add capacity, improve processes, take on new roles, and really build up the competence that had diminished in recent years. All of this work has taken a personal toll on so many people. I put myself in that category, she said. Leaving for personal reasons, maybe. Or maybe something else is happening. Maybe someone is getting out while the getting is good. That's a very strong possibility. The news of the next impending Liberal scandal, well, it broke Wednesday night while the media was fawning at Trudeau rehashing the speech from the throne. You see, Trudeau scammed the mainstream media to cover his dinner hour address by assuring news outlets it was important, nonpartisan, non-political information all Canadians need to know. Instead, we got a political speech about the Liberals' plans for the country, and Trudeau telling us that we are Canada, not Cantada, in his usual breathless, pretentious, moronic, and patronizing way. It was a masterful distraction, really. Trudeau was ragging the puck. He was winding down the clock on the news cycle so that the opposition parties weren't able to respond to his AOC-style speech from the throne during the 6 o'clock news. But Trudeau also did that to bury the news on the latest Liberal scandal you probably haven't heard about yet. Look at this in the always incredible Blacklock's reporter. Internal auditors have been called to review mismanagement at Dr. Theresa Tam's Public Health Agency, officials said yesterday, so that was Wednesday. It follows disclosures the position of Chief Health Surveillance Officer, specifically assigned to watch for pandemic outbreaks, was eliminated 3 years ago. The scope of this audit predates the Public Health Agency's COVID-19 response, staff wrote in an audit of surveillance activities. The agency's response to COVID-19 will be reviewed in other internal and external audits. No deadline for reporting of findings was detailed. The agency, in a 2007 draft plan, promised a, quote, coherent approach to surveillance and even appointed a chief health surveillance officer with staff. The chief health surveillance officer position became vacant in 2017, said the report. The job was eliminated, wrote Auditors. No replacement was named and duties were never reassigned to other managers. Key responsibilities formerly assigned to the chief health surveillance officer were not redistributed, including for oversight of strategic surveillance plans, wrote staff. This audit should have happened months ago. The moment the public became aware, the Public Health Agency threw out 2 million N95 masks and 4,400 medical gloves when it shut down an emergency stockpile warehouse in Regina. The agency did that in spring 2019 and never replenished any of that stockpile. We won't know as Canadians the full extent of the mismanagement at the Public Health Agency of Canada until the Liberals are out of power and outside auditors are finally called in. For Rebel News, I'm Sheila Gunn Reid. Dr. Theresa Tam and the Public Health Agency of Canada have mismanaged the COVID-19 response here in Canada. They've stoked the fears of Canadians and sent mixed messages. To see more of our coverage of the failures of Theresa Tam at the Public Health Agency of Canada, please go to firetam.com.